Hi, this is Sarah, and I wanted to make a short video to talk to you about the POTS and Dysautonomia Treatment Center, explain a little bit about what they do, and talk to you about my sister Hope. The POTS Treatment Center is located in Dallas, Texas, and they work to treat dysautonomia and related disorders for patients all over the world. And they do this through the use of something called biofeedback. The staff of the POTS Treatment Center is a small but dedicated team of neuroscientists, psychophysiologists, medical doctors, psychologists, psychotherapists, and nutritionists who all specialize in dysautonomia. Together, they address each individual patient's needs through a combined holistic approach. So firstly, what is dysautonomia? Well, dysautonomia is just an umbrella term for a multitude of autonomic nervous system disorders. One form of dysautonomia that my sister and I have is called POTS, P-O-T-S, and that stands for postural orthostatic tachycardia syndrome. Basically, what that means is that during a postural change, like when we go from sitting to standing, there's an abnormally large increase in the heart rate. However, the symptoms of POTS are much more complex than just tachycardia, like the name perhaps suggests. For example, POTS patients, myself included, commonly have the following diagnoses like small fiber neuropathy, hypovolemia, which is low blood volume leading to poor cerebral blood flow, mast cell activation syndrome causing immune system dysfunction, and high levels of plasma norepinephrine, which increase sympathetic nervous system activation. We'll talk more about that soon. These are just a few of the many and sometimes debilitating symptoms that POTS patients deal with, and it may vary between patients. POTS is a complex syndrome. Currently, there is no cure. For years, I was dependent on a wheelchair for most mobility, if I was even able to get out of bed at all. However, after going to the POTS Treatment Center, I found a significant reduction in the severity of my POTS symptoms. I was able to regain mobility, and I found significant improvement in my quality of life. They do this by addressing the autonomic nervous system dysfunction. So, what is the autonomic nervous system? The autonomic nervous system, or ANS, is part of the peripheral nervous system. It is composed of two parts, the sympathetic and the parasympathetic nervous system. I learned all about these differences between these divisions during my first year here in Bordeaux for my master's in neuroscience, but I will spare you the details for now and say basically that the sympathetic and parasympathetic work together to create homeostasis automatically in the body. So it's doing everything that we don't have to think about, like heart rate or digestion. However, certain environmental or internal stimuli can trigger one system to activate over the other. The sympathetic nervous system is responsible for something we call the fight or flight mode. Now, this is wired in us to react in situations of danger. Our body sends the energy only to where it thinks we absolutely need it for survival. And then the parasympathetic is responsible for the rest of the time, when we are relaxed and in the rest and digest mode. But because I have POTS, my sympathetic system is being constantly flooded with signals of danger. Remember the high levels of norepinephrine I mentioned earlier? Well, that's keeping my sympathetic nervous system engaged and my fight or fight mode on, permanently. So as you can imagine, these high levels of stress is damaging to the body and may be responsible for the manifestation of many POTS symptoms. Now, this is why biofeedback is needed and why it works. Biofeedback is basically like a mirror for your nervous system. You know how you get ready in the morning to fix up your hair? Well, you can kind of use biofeedback to do the same thing for your body, and you can fix up your nervous system. Biofeedback helps to reestablish homeostasis in the autonomic nervous system. At the POTS Treatment Center, their team helped me to understand how I can specifically control my sympathetic response and promote relaxation in the ANS. For example, recorrecting my pupil dilation and stimulating more digestion. And at the POTS Treatment Center, I learned how to control and lower my heart rate and improve blood circulation. After years of treatment, surgeries, and medications, I honestly felt a difference in just the first few days. And for me, the biggest relief was real pain management. Learning to actively relax my body greatly reduced my chronic pain. I'm still using the biofeedback techniques I learned at the POTS Treatment Center today. They do this technique training through several methods of biofeedback and heart rate variability control. They also offer many other therapies such as nutrition, counseling, and overall wellness management. Going there was the best thing that I've done for my condition. And right now, we're fundraising for my younger sister Hope to be able to do the same. Hope also lives with POTS. Unfortunately, she has relapsed, which is not uncommon with this illness, especially at her age. She needs another chance with her developing body and mind to receive care at the POTS Treatment Center to improve her health. And we need your help to cover the costs. But I believe in biofeedback, and I know that this will make her feel better in her recovery. I believe in miracles. I believe in the power of community. Mostly, I believe in my sister, in her resiliency and her fierce love of life. I believe in hope. Thank you.